Hello, everyone. Butterfly Ayurveda welcomes you to the third wellness webinar of the Balance series, an initiative taken by Butterfly Ayurveda during the time of COVID-19 and the subsequent lockdown. This webinar is once again on mental health in conversation with Dr. Prerna Kohli. Butterfly Ayurveda is an organization engaged in the research, development, manufacturing, and marketing of Ayurvedic products. These products range from immunity-boosting Ayurvedic medicines for lifestyle-related disorders to herbal teas, infusions, cookies, and also a niche vertical of Ayurveda-inspired bakery items. I am Akshi. I am the CEO and founder of Butterfly Ayurveda. I started the company in 2014 and have learned a lot over the years. I was selected as one of the 19 women entrepreneurs to be part of the US Fortune Mentoring Partnership Program in 2019. I'm also a Bharatanatyam dancer, a martial arts student of Tai Chi and Qigong. I have often organized wellness workshops and programs that help increase the body, mind, and spirit awareness. Mental health is very close to my heart, and I truly believe that there is no health without mental health. On this note, I welcome an eminent clinical psychologist, Dr. Prerna Kohli, with over 25 years of experience, a published author who practices logotherapy. She's also a recipient of the 100 Women Achievers Award by the President of India and has been a member of the POSH Committee for the Press Information Bureau of India, a volunteer therapist at Tihar Jail, and a life skills coach at the Gurgaon and Aligarh prison. As an advisor to the National Commission for Protection of Child Rights and a member of Niti Aayog, she works towards making the workplace and country safer for women and children. A prolific writer and a published author, Dr. Prerna Kohli has been a keynote speaker at World Depression conferences across the globe. She gives frequent interviews to the press on mental health issues, conducts heart-based workshops in schools and universities, and gives corporate lectures on maintaining work-life balance, creating self-awareness, and developing inner peace. A very warm welcome to Dr. Prerna Kohli. Over the next 30 to 40 minutes, we will be taking up questions that we received in our inbox after the previous webinar on mental health. Dr. Kohli, I welcome you.
Thank you very much, Akshi, for having me over again. It was a wonderful session last time, and I'm sure that people will gain something from this sessions of question answers to increase their immunity and feel more strong and resilient to face the times of pandemic and subsequent lockdown.
Yes, yes, of course. So I think we'll begin with the questions. And like you said, it is the time of the pandemic. There has been a significant rise in mental health issues during this time. And then the lockdown was announced. So while we are all so stressed about these unprecedented times, do you think that this has given rise to more anxiety? And how does one identify whether one is under stress or is feeling anxious? How does one identify the telltale signs for this?
So actually, this is an interesting question because I've seen almost a 60% growth in my counseling sessions, all right? And the Indian Psychiatric Society did a survey and found out that due to COVID, 1 out of 5 is suffering from either stress or anxiety. The anxiety has really spiked. It has spiked because of uncertainty. Anxiety comes up when we don't have things in control or we do not have answers. Stress happens when we are under pressure, but still we can be in control. Only when the pressure gets out of control, we might get stressed. all right? But the next level of stress is anxiety, when you are under pressure, feeling totally out of control, and you really don't know what to do with yourself. So stress is good stress when it propels you to do something, but bad stress when it gives you sleepless nights. Having said that, very clearly, anxiety has its own telltale signs like palpitations, increased heartbeat, cold hands, sweating, low motivation, lack of energy, having a bad stomach, all right, wanting to not eat anything, withdrawing from people, you don't want to socialize, you are just, in an obsessive, recurring thought again and again. So these are a very clear telltale signs of anxiety.
Right. Um, I just want to know if the signs in men and women are different for anxiety.
Very clearly, even though it's felt that the man is the bread earner, typically from the time immemorial, and he should be the one who should be more anxious, but very typically, studies support women to have higher anxiety levels than men. It comes from their maternal instinct, their nurturing feeling, where they feel, more responsible, whether as a mother or as a wife, to do more than to look after themselves. So very clearly, women are showing more anxiety than men when we see the studies, because they put others before themselves as a conditioning also.
All right. And as we move forward, I think you will be sharing with us how one can handle these symptoms or signs
Of anxiety.
Yes, yes.
Yeah, so, we did talk about a lot of techniques last time,
Yes.
right? We talked about a lot of techniques of, accepting and acknowledging what is happening around you, exercising, eating well, sleeping well, all right? All these things that we did talk about a lot last time would be able to help you look into your anxiety. When you are able to be in control, I keep on saying that, be realistic about what you can control. You cannot control the way economy is going right now. You cannot control how long this pandemic will last. You cannot control the government regulations. But what you could probably control is, the hobby you want to take up, or the skill you want to acquire, or that particular, exercise you want to do every day, or maybe plan your finances better with whatever money you have, or start thinking about how to bring about change in your lifestyle at home, working from home. These things are in control. So one has to be realistic in what is in control in ourselves and what we could do, and then we'll be able not to feel anxious.
Yes, thank you. Yes, we did cover a lot last time. The second question is, while we see some great stuff happening on social media, especially, couples cooking together, exercising together, yet at the same time, it is not as cushy as it seems. We recently received a question from a content writer who's, of course, now working from home. She says, I'm fed up with my husband. He wants to supervise everything I do and overhear my phone calls, and stands in the kitchen while I'm cooking. This is very stressful. How can I balance my job, mother my husband, and take care of my 7-year-old child all at one time?
See, it's unprecedented times. These are tough times, all right, because we are not used to living together. Everybody's had their set of routines and their set of work. So I would tell, for a person who's asking this question, that you have to do time management for yourself, all right? Set a definite routine for yourself where you are balancing your time, and you're balancing a me time for sure. You have to have a me time. It's like training your mind. Like, I think we all have trained our minds that we do have that place for that favorite ice cream, no matter how full we are after food. Similarly, you have to train your mind that no matter how busy your day is, you have to have that me time space where you're able to probably do some breathing exercise or do some dance or follow any hobby where you're able to be in a calmer place. As far as your husband is concerned, it will help to increase communication with him. Talk to him that, listen, these are not easy times for me. Because, many of the men folk take women's domestic work, like household work for granted. They think that if there's no domestic help, the woman will do it. But it's time that you increase communication and spoke to your husband about it to help you. Maybe you're not even asking for help. Having said that, the task you give to your husband should be tasks that he can manage. He probably can't cook a dal, but he can help you probably peeling the potatoes. Or he can help you probably folding those clothes. Men like appreciation. Men like to complete a task. They take it on their ego if they're not able to. Having said that, there are a lot of men who are genuinely helping. Those who are not helping are also the men who are irritable themselves. They're going through their own depression, their own anxiety, but that doesn't give them any reason to be either abusive or get into any kind of verbal fights with their spouses. So I want to use this platform of Butterfly Ayurveda to reach out and say that, please, your wife is working from home. She's looking after that child who's not going to school. So that routine is also a tough one. She's also looking after you, and she's not used to having you in her space. Please be more cooperative, have more compassion, be more adaptable. And, fighting or answering back or being abusive is not normal. So women should not accept it. They must speak out, don't make it normal, and take some help from support group. Maybe call up some friends and talk about it. Maybe reach out to certain numbers which are given for help. So don't bow down to this. And also I would like to tell the women that please don't feel guilty. Do the best you can in the given circumstances. You can't make everybody happy. There is no end to finishing the housework. There's no end to completing your own work that you have. So you have to balance here. You have to have time management. You have to have your routine. And also, now that you're talking, you have a child, I would also request to avoid any kind of conflicts or having any kind of domestic fights, because it will have an effect on the child in a very big way. This is a home which is a home of safety, comfort. There are already a lot of challenges. Maybe your child is not even going to school, is not able to meet the friends. It's very important to have a calm and conducive environment at home. So make your peace, have your routine, have your me time, increase your conversations with your husband, give him simple tasks. Also make time, space, task separations, so everybody knows what they're supposed to do at any particular time in the day. I think this should be helpful.
Thank you, Prerna. That was a wonderful answer, and it really clarified a lot of things. Like you talk about children, we've been receiving a lot of questions. And in fact, we have some questions in the Q&A box. And she asks, Doctor, I'm homeschooling my children since distant learning has begun in schools. However, my children are saying that they miss school and they miss their friends. They feel everything is wrong, and they don't know when will they feel right again. What do we tell them?
This is extremely a difficult time for the children. We have to realize they have two worlds right now. One is home and one is the educational institution. Whether it's school, whether it's college, their world has come to a halt. All right? They are miserable. They are children who are not able to meet their friends, do any co-curricular activities, and have those real life experiences of playing together, laughing together, or doing some activities together. That the energy they miss, and they're so full of beans and energy at their young age. So it becomes extremely important that you have a routine for them, which includes the kids in such a way that you're able to do a lot of things with them, and things which are also fascinating and new to them. It could be doing some new projects, new board games, or teaching them gardening, or maybe some new dish, or telling them new stories that they haven't heard. something the child looks forward for every single day. And also help them socialize and meet their friends through video calling, help them do some projects together. Children are celebrating their birthdays with other friends on the videos, but you will have to also spend a lot of time with them. You know, busy children are happy children. You have to tell them that this is a challenge which has come. Depending on the age group, you can tell them that we need to maintain a social distance, we need to do this. And the way you are role modeling yourself, the way you are conducting yourself will also be very, very helpful for the children, because children are really not listening, they're watching. And they watch you being calm and having a routine, doing your exercising, having your me time, having a good space. They would learn to do the same. You know, so it's very important that you keep them calm and get them engaged in a lot of activities. You know, productive kids, happy kids are the kids who will not feel that boredom or miss going to school. That's what I would suggest to you.
Thank you. Thank you, Doctor. We got another question in our inbox regarding children, and this one was specifically for stubborn kids during lockdown. How to tackle stubborn kids during lockdown, and teenagers who require space, which is very understandable during this time. However, they seem to stay locked in their rooms most of the time and don't want to mingle with the family. This is adding on to the already existing stress. The parent is asking, how can we cope with this?
So this is really happening in most of the houses where there are children. I really don't know whether it is really stubborn, or sometimes I feel we call our children very stubborn and very obstinate. But I think they have a lot of clarity of thought, so maybe they're not stubborn, they're very clear. Also, if they're really stubborn, are you stubborn? Are they mirroring you? Are they really copying you? Do you really do things when they ask you to do something? As I said, mirroring is huge during this young age. As far as teenagers are concerned, they're already going through a lot of hormones. They're already going through so many aspirations, so many desires. There may be teenagers who were scheduled to go overseas. There may be teenagers who missed their convocation. There may be teenagers who might have to drop a year, maybe drop many of their dreams. So for them to go through depression is also very understandable. You have to be also a good listener. Talk a lot to your kids so you know what exactly is going on in their mind. The more you will talk, the more you will realize what they're feeling and thinking, and you will be able to support them. You know, just giving instructions to do things will not help. You'll have to make them participate with you. If there's a routine, involve them, ask them what they like to eat and how they would like you to probably, you know, help in doing their project, or maybe helping you set the table, you know, or helping you do certain activities, like probably looking up some words in the dictionary that you can't find, or maybe doing some drawings together, maybe just, you know, doing some cartoon strips together, maybe, you know, reading a poetry together, literature together, things that make even the teenagers learn new things. Also, if there are certain things your teenager is interested in and you don't know a thing about it, read up. Ask questions which interest. Half the time children are in their room because they don't have anything to converse with you, because there are hardly many topics and you feel there's a gap, but the child can only talk that much. So if there are certain topics, could be cars, could be heroes, could be superheroes, read up and ask questions. It could be a question answer session. The child feels very loved, very interested, very wanted. And also involve your child into the daily routine and give the task, maybe even a small task to the child to complete for the day. That way they feel useful. That way they feel they're also part of it, and they make a difference by sitting at home also. Also, even with teenagers, see that they're able to, you know, connect with their friends. They're able to exercise at home. They're able to, you know, eat well. They're able to sleep well. So you have to really step up yourself and make that extra effort, because the teenagers are really going through a tough time, and stubbornness is a form of depression too. So just see your teenager is not into any kind of substance abuse, is not experimenting in too many things. So keep a watch on the child and be very, very supportive with the child.
Thank you, doctor. Thank you very much. From children, now we are moving on to, we are getting a lot of questions regarding senior citizens, parents, family who's living away from us. And a lot of people have expressed increased amount of anxiety. And we know what elders are going through. And we get another question in the Q&A box. And they're asking the slightest sight of a sneeze or a cough, and we start getting all paranoid.
Yeah.
Elders are also on tenterhooks and even more worried than we are. Doctor, how do we handle this?
Yeah, it's not easy for all those parents who are asking this for their older parents, because they have children to look after, they have older parents to look after. The fact of the matter is that the elderly are as vulnerable as the children are, all right? And they are suffering more from anxiety because they, like children, young children, feel very helpless and very dependent, all right? So it's just that we resonate more with the children because we have been a child sometime. It sometimes gets difficult to resonate with the elderly because we haven't reached that stage. But empathy would really be of a lot of use here, where you are able to empathize their position, where there's already having the fear of death anxiety because maybe of the age, or maybe they're already having some ailments. And the elderly are always into wanting to know more about what is happening about the illness. So they're really probably having the news channel on all the time, or they're reading a lot, or they're asking you find out about the spread or anything else is happening, how many deaths have taken place. So I would really encourage you to limit information of any kind of media, electronic media, whether it's print, whether it is social, whether it is broadcast. Because if they keep hearing news, which they are hearing to decrease their insecurity, but if you keep hearing the news, they are only increasing their insecurity by having an overload of information. So, you can tell them, we will talk about, the pandemic, which is very important because they need to be informed. It settles them maybe in the morning at one time, maybe in the evening at one time. So please limit the consumption of media with the elderly. Keep them informed, but not over-informed, because that will help them to reduce their anxiety. Also see that they are involved in doing some simple exercises. They are having some kind of their own routine, that routine which is also matching with your routine. So it becomes a safe space for the family because we start doing things together. There are a lot of families who start playing carom board together in the evening, say from 6 to 7, or they'll play Ludo from say 7 to 8, or they start playing Intakshari. So everybody looks forward for that particular 1 hour together, no matter what they're doing throughout the day. So that is very important, to get the family together, keep them informed, keep them involved. Also, make them feel important by asking them how would they like the routine to be. Having said that, the parents who are away from you, see to it that they have the support system around them. Give them the numbers of the neighbors. Keep in touch with the neighbors of your parents. Give them the numbers of the neighbors, or maybe certain hospitals, certain doctors, just to give them that moral support. And you'll have to be in touch with them every single day for a particular time, for a certain duration of time. And that is true for children also. If you've told them that I would be spending 4 to 5 p.m. in the evening with you, or 11 to 12 in the morning, please live up to that time, because whether it's a child or whether it's the elderly, they're really waiting to spend that time with you. Yeah, so the trust is very important, because anyways, they're so conflicted, they're so confused. So this kind of support will also keep you at ease and keep them at ease. Keep your conversation, keep your communication on, right?
Thank you, doctor. I would just like to add on to this question only. It's like an extension maybe. I got this question inquiring about there's this obsessive behavior sometimes by the elderlies, or even by certain people, to just keep healthy all the time because they are so stressed and anxious. What would you say about this? Do you have any comments on this?
No, see, it's all right. They would be. This is their mood because, as I said, it's something like information. They want to be informed about the coronavirus. They want to be informed about the pandemic. They do get into a obsessive behavior about having certain kind of foods, having certain kind of routine. And I'll tell you, if this works for them and if they are fine with it,
Yeah.
then so it be, because everybody has their own way of dealing with their issues. It may not be working for you, but it works for them. We need cooperation, we need compassion here. And at least the time of challenging times of coronavirus, we need to be more kinder and be the bigger person and understanding.
Yes.
In the regular times, it's a different thing. But right now, it is getting exaggerated. Yeah. So it be if that gives them comfort. And as long as it's not coming in your way of any routine.
Yeah. Thank you. My next question would be, so I was, very recently on social media, and I came across this, and I think this would resonate with a lot of us. I read this comment by someone: I feel pressurized to be productive the whole day. What would you say about this?
So very interestingly, a friend of mine had sent me a message which read something like that: if you are not acquiring any knowledge, if you have not developed any skill, if you do not have a side hustle in this pandemic, then it is not that you are lacking time, you are lacking discipline. To which I replied back that, we are going through collective traumatic experience. For everybody, the coronavirus pandemic is not fun and productiveness. Some of us are barely trying to keep our mind and body healthy. And so our focus should be that we are healthy mentally, emotionally, physically. And that's it. That's also really good, because I have people calling me up and saying that I am having sleepless nights, Dr. Kohli, because I've got into this, recipe challenge, and I have to come up with a new recipe. I can't sleep at night. And I'm telling that lady that please don't be part of such challenges. We're already having enough challenge of the pandemic. Don't add to your woes. Okay? So your focus should be to be healthy and not make this a competition, pandemic, a competition that, you have to be on the sari challenge, you have to be on that song challenge, you have to be on the Dindi challenge, you have to be on child mom challenge, or that family photograph challenge, or those 10 years of togetherness challenge. If these things are bothering you, don't be part of them and express yourself. Express yourself. Tell your group, your tribe that, listen, I have enough on my plate. Maybe I have to be working from home. Maybe I am also cooking. Maybe I am cleaning. I don't help just now. The household help is not coming. Maybe I have to cook a special meal for my father-in-law who's not keeping well, or maybe I have got so many other things that I can't be part of it. But that doesn't mean that I should be feeling isolated. So when you're able to convey to your people, they understand. And also you must be able to say yes when you want to say yes and no when you want to. Don't do this self-pressurizing things. Pandemic is not about a competition. It's not about being productive only. If you can be productive, if you can gain knowledge, if you can have a skill, good for you. If you can't, that's also perfectly fine. Just stay healthy and stay calm.
Yeah. On that note, many of the viewers have been asking about disturbed sleep patterns during this lockdown, just like you said right now. So what is your advice to them?
Also, yeah, one of the things about spike in anxiety is losing your sleep. You just wake up, thinking about your future, thinking about that, maybe that installment that you have to pay, or maybe the job you might get fired from, or, some loved one falling sick. These are very normal things to happen. First, no, it's normal to be feeling like this, but to have sleepless night is not healthy, because the brain has to rest, to reset, to reboot, to realign. to be able to have a better perspective about your life and things around you, you have to sleep. And the only way your mental and emotional immunity will increase if you have a good night sleep. So I will put sleep even above food and exercise, because otherwise your brain will get into disoriented phase. It will get inflamed and you will have unrelated issues. Even for children, they will, if they sleep well, they'll have a better recall, they'll have better memory, they will be able to be more proactive, they will come up with more creativity. So sleep is extremely, extremely important. And sometimes, we are not just anxious, we're just not in a normal, healthy routine of sleep. So it is important that you sleep at the same time every night. It cannot be a sleeping at 7 one night and 11 one night, or 8 p.m. one night. Consistent time is very important. See to it that you've not had a very heavy meal, not had too much of like fried stuff, whatever junk food you may call it, lighter. I've had few hours earlier. Your room must be very conducive. We cannot have food lying somewhere and clothes lying somewhere. It has to be a clean room. It also have to be a room without any kind of aroma, strong aroma. You can have your fused aroma of, sandalwood or, lemongrass, but not something which makes you repulsive. You also have to have the correct temperature, the correct lighting. Also decrease your electronic consumption here, because whether you're on the phone, whether you're on iPad, the light coming out is exciting your brain, no matter what you're watching. You could also read a book, will make you sleep well. You could also listen to soft music. Telling you about these lifestyle changes is very good, which is very, very conducive. But what will also help is certain kind of natural therapies. Natural therapies like, if you are done chanting at night, or you've done some kind of good breathing at night, if you just include like ashwagandha, brahmi in your diet, this will also help to work on your nervous system, help you calm down, give you better sleep. Having said that, Akshi, you are an expert in this domain of Ayurveda. What do you have to suggest to people about a good night's sleep?
Well, thank you, Dr. Kohli. Yes, I strongly believe in Ayurveda, and all that you said is completely a part of Ayurveda as well. A healthy routine is a must for a good night's sleep. And I highly recommend Butterfly Ayurveda's Ratri Chai, which is actually composed of the herbs that you named. It has ashwagandha, brahmi, shank pushpi. And herbs like these, they help you relax the nervous system, relax your body and mind, so that you get a deep, restful sleep. And you wake up feeling very fresh. You can also check out our website to know more about our products. Yeah.
I'm going to start having that Butterfly Ratri Chai then, that's for sure.
Yes,
Yeah.
absolutely. Oh, well, this was a lovely session. Doctor, I would like to ask you if you have any other handy tips, any small suggestions that will help us to manage our stress and anxiety during this time before we close.
Yeah, so I just want to tell you that everybody has their own way of coping to their stresses and their anxiety. It's all right to feel what you're feeling, but don't let it come in your way. Do have a routine, to eat well, sleep well, exercise well, do your breathing exercises, do yoga, do have your me time, it's a must. Have a gratitude journal, do have your worrying window at one point in time where you do not worry the whole day. Also, be more compassionate, become a community person, reach out to people, socialize more. You could be singing, dancing, chatting with your loved ones. Feel that this is a challenge that I'm facing, but we all are into this safe space together. We're all into it. Pandemics get over, sufferings get over, economies boom. So be realistic in whatever you're thinking, and be in a space of introspection, reflection, and see how you are going to go back to what is going to be normal, and what are the things you want to really go back to. This is the time which has made you realize to reboot, to reinvent, to readjust, and see that how you are going to go back to what normal is going to be for you. So all my very best. Stay healthy, stay calm. God bless.
Thank you so much, Prerna. Thank you, Dr. Kohli, for such a wonderful session. I want to recommend to everyone that you can visit our YouTube channel and have access to the previous webinar on mental health, where Dr. Kohli has shared the tools and techniques to manage stress and anxiety. And thank you, Dr. Kohli, for such a wonderful start to the day.
Thank you. Thank you so much. It was such a pleasure. Thank you for having me.
Thank you, Dr. Kohli. That was wonderful. Stay tuned for more of these conversations that we will be hosting in the upcoming months. And please send in your questions to balance@butterflyayurveda.com. Stay healthy, stay calm. Also, I would like to thank all of you for attending the webinar and making it a big success. Our upcoming Balance event is on Ayurveda, where we will be talking about Ayurveda and how we can integrate it into our everyday life to improve our overall health. So stay tuned. It will be on 29th May, 11 a.m. onwards. Thank you very much. Have a fantastic day.